Hey guys, what's going on? It's your girl Nurse C with the Medical Tea. And as promised, I have a new CDC update video. So about almost 3 weeks ago, I made a video based on the CDC, Center for Disease Control, guidelines on how to stop the spread of coronavirus and the things that we need to do. Then I followed up with a new video about the self-quarantining and staying home and how you guys can help fight this terrible virus. As a working nurse in a hospital environment, which is a acute care facility, right now we are limited in supplies and limited on, basically we have more patients than we have healthcare workers that are battling this disease every day. With New York being the epicenter of the disease, it's very difficult for New Jersey to try to keep up with these numbers that are surmounting every day. So thank you to the ones that are staying home and following the self-quarantine, and you guys are much appreciated. We appreciate the level of knowledge that you guys are obtaining about this, and thank you guys for all of your condolences, for just showing love for me and my family during this time. We lost a loved one, and I appreciate that, and it doesn't go unnoticed. So now let's get down to the nitty-gritty. There is new CDC guidelines. So about 2 or 3 weeks ago, the guidelines were that if you was not sick, you didn't need to wear a mask. The people that needed to wear a mask were primarily immunocompromised people, i.e. people who are on steroid therapy, people who have cancer, people who have HIV, people who have respiratory issues. Those were the people, and elderly were recommended at that time. Well, now based on new studies that have recently come out about COVID-19, aka Corona, BKA, that Rona, and BKA, the Roro, they're saying based on the New England Journal of Medicine that right now, because people can have corona and we don't know who's affected because they can be considered asymptomatic, which means they're not showing symptoms, but they're a carrier. Because of this, they're asking that the public start wearing face cloth masks. These masks will prevent you from spreading the disease if you have it and just don't know that you're a carrier. So they're asking this, for one, if you're in a close proximity where social distancing is harder to do. So say you go into the grocery store, or you are in Walgreens or CVS, and you're trying to practice social distancing as much as possible, but then maybe, other people are not practicing it as well. Well, if you're wearing a face cloth mask, then at least if you're a carrier, you're not spreading it to your elderly neighbor, to your immunocompromised person, and this will slow the spread of the disease. Right now, New York has reported that they are on the verge, as of today, Sunday, running out of ventilators, which means that they will have to put 2 patients from 1 ventilator, which is not what our ventilators have been made for. So this has become quite a bit of a medical emergency at this point, and the patients from New York are coming to New Jersey, and now we're getting a hit with a lot of COVID patients, and then so forth. It'll move down the line to Pennsylvania. So we want to slow the spread, number one, by only going out unless you absolutely have to. But if you have to go out, I want you to wear one of the face cloth masks that you can make at home. So the surgical mask and the N95 mask, we're really trying to preserve for the healthcare world. We have dietary, we have environmental services, we have nurses, doctors, CNAs, respiratory therapists who desperately need this equipment. And because the surgical mask is not necessarily going to protect you from getting corona, it protects us from spreading it. The cloth mask does the same. So I'm going to ask my lovely, lovely, lovely assistant, my husband, to come and demonstrate what the cloth mask looks like. A lot of healthcare workers have had family members that felt the need to make them for us, and we're so ever grateful. So I have one here that was made by one of my co-workers, and I have 2 actually, and the other one is from my other co-worker's daughter. So Donnell, can you demonstrate wearing the face cloth mask?
Yes, I definitely can demonstrate wearing the face cloth mask.
Put on a face cloth mask. So you see that it's simply, you just make it out of elastic bands, and you can make this from stuff you have at home, like I've seen some people use like shoestrings and things like that. And then like this might be an old scrub top that somebody had, and they just, you know, put this together real quick. And it's very easy because you don't have to wear this long. It's not going to have ear breakdown, because a lot of the nurses now, from wearing a mask for 12 or 13 hours, can develop ear breakdown. So to minimize that, you can also wear like a headband, so a button. Guys can put like a clip or something on their hat to wear this out in social settings, such as the grocery store, CVS, where social distancing becomes a little harder. So can you put this on down there?
I can.
Thank you. So you see there. So you see, this is just a simple cloth mask that you can wear that the CDC is now asking the public to wear. So even if you're not sick, but you have things that you need to do, I would ask that you would try to make one of these at home and wear them out, so that if you're a carrier and you don't know it because everybody's not being tested, at least you're not spreading the disease and spreading the virus to unknowing, because elderly still have to go out. They have nobody, unfortunately. Immunocompromised people have to still go out. They have nobody. And we don't want to spread this virus to them and unknowingly do so and cause more cases and numbers to rise. We're trying to stop the spread by slowing the spread. So thank you. Thank you, Donna.
Thank you. Appreciate it.
Yeah, thank you. So I just want you guys to stay informed, be aware, and as always, please do your own research. This was new research updated by Center for Disease Control, www.cdc.gov. You can also go on World Health Organization and find new research as it comes out. Every day we're learning about this virus, guys. This is something that we haven't seen before. The virus has now mutated twice, which means it's changed in the way that you can be affected by it. Nobody knows. There's no way to describe how your respiratory system will deal with the virus versus my respiratory system. Just know that anybody can get it. These face masks are not recommended for people who have respiratory issues, which is why we're asking people who are fairly healthy to put these on, and children under 2. These are not recommended for them according to the CDC, because they can't, anybody who can't willingly by themselves remove the mask quickly if they have like an anxiety attack or panic attack, those are people who are not recommended to wear the face cloth mask. So this is the new update, guys. It's Nurse C with the Medical Tea, and like I said, I thank you guys for all your shares, all your likes, and just taking heed to this information. I do the research so that I could bring this to you and to our community. Unfortunately, today I saw a lot of people out and about. I don't know if people, I even heard a girl having a conversation about having people come to her house. And as much as it took for me not to blow my top, I just, I tried to not be that person that's like going off. But this is serious. We need to keep social distancing. We need to keep staying home as much as possible. We need to do what we have to do so that we can do what we want to do. So until everybody gets on board, who knows how long this is going to last, but just know that we are all in the healthcare world working very hard to combat this. We have researchers are doing working 24 hours to fight this thing. We want our kids back in school so that they can have socializing with their friends. We want the seniors to be able to socialize with their friends. We want to all have some part in this to get back to normalcy. So I just hope that you guys take heed to this and try to follow it as much as possible. Again, do your own research at CDC, Center for Disease Control.gov, or World Health Organization, better known as WHO. And I hope to see you soon. And I don't know. Thanks. Just thanks. Nurse C with your Medical Tea. I'm out. Bye.